This is part 3 today. So shall we recap? Yeah, we've got those up there, Caleb. You just got to tune in every morning during the weekdays. I don't have any. I don't off to bed. All right, yeah, it's late where you are, or early, I guess. If you're just going to bed, it's late. If you're getting up, it's early. Hannah got to practice drawing blood on a dummy. Yeah, they don't move around. Yeah, Toradol. I think Toradol is like 15, 30 seconds, so it's not a huge deal. Um, but a lot of these meds, like bad things can happen if you push them too fast. So that was part 1. So we had Toradol. Pepcid is the one that people don't realize. Zofran's another one that you should really push slowly, though I've never pushed it over 2 to 5 minutes. All right, this is part 2. So these are like mostly cardiac meds. So Dilts, hydralazine, which is, I don't like hydralazine at all in the ER. There's just not a lot of evidence to support that, but we still give it. Got to push that kind of slow. Labetalol, at least 2 minutes. Metoprolol, 1 minute. Decadron, that's the fire crotch, right? Like you push that too fast, you're gonna their perineal area is gonna feel really on fire. And then Lasix is also, you got to push that slow. That can cause autotoxicity. Oh, no, 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 no. I cannot believe they even allow a name like that. Dude, hang on a sec. Hang on. I gotta get rid of somebody in here because I don't have any. There we go. Yeah, we got to get that one out of here. I can't believe they allow that name to even be in here. There we go. What was it? Was something about the title? Can you move it? I can't see the beginning of the letters. Oh, is it like too zoomed in? All right, so that's part 2, right? Yeah, paralyzed posty. I have 2 because I can't get a stream key for TikTok. So this black mic here is for Substack, and that records, like, it automatically makes clips, which is great. Relevant clips, like breaks it down. So I like that. I'm working on getting a stream key. If I can get a stream key for TikTok, then I can just use one mic and just multi-stream. All right. So now that's part 2. We did that last week. This week, we're doing part 3. All right. So yeah, Narcan. You got to push Narcan kind of slow. You can't be slamming that one. It's echoing a lot. It's because I was turned away from the microphone. That's why, because I was bouncing off. Callie Gilbertson, good morning. Welcome in. He used a font so he could bypass the filter. Oh, is that what it was? Oh, gotcha. Yeah, it was a weird font. Yeah. Good morning, Amanda Danell. Welcome in. We're talking about part 3 of medications you got to push slow. No, etomidate. Yeah, that didn't really show up too good, did it? Looks okay, though. I can see the preview. Yeah, that's Haldol. I've heard of Narcan spray, but do they? Yes, we have. Yes, we do have IV forms. Okay, Ruby's coming off a bad trip. That's awful. Not much I could do for you from here, Ruby. Go to an emergency department, have somebody take you there. Nothing I can do for you here. Oh, okay, good. Hannah can see it now. Perfect. Yeah, so Solumedrol is one of those ones that was news to me, right? Like I did not know it had to be pushed that slow. And so that's something I've definitely got to address. Because that I was going down, I was like, yeah, I've heard that one. Yep, that one. I got that one. Like, oh no, I didn't know that one was that long. Like I don't push anything fast, but I'm definitely not pushing Solumedrol that slow. But the number of comments on my other posts, even here on TikTok, a post I did here, the people saying that they would slam that med, that's just scary. I mean, really, that is scary. If you are a patient And you know, I mean, if you have any medical training, if you're a patient and they're slamming meds, I would definitely ask why they're doing that. Like, what's the push rate on that? Because there's only like 2 or 3 meds. So, like, any of your paralytics, and if they're pushing a paralytic, you're not gonna be ready for that because you're gonna be sedated. So, you're not gonna even know that. So, your rocuronium, succinylcholine, which we don't really use sucks anymore, but those you can push fast. Atropine, you can, because if you don't push it fast enough, now you don't have to slam it, but if you don't push it fast enough, it can cause reflex bradycardia. And then, of course, adenosine, you have to push fast because it has such a short half life. Everything else, you can go slow. There's like really no reason to slam anything. Um, Rocephin, ceftriaxone, that's another one that you really got to. We don't even push those IV. We used to put them in a syringe and we had syringe pumps, right? And then they took those pumps away and they gave us Baxter pumps, which you can't really do a syringe on those. So now we just do IV bags, like mixed, and you just run them over 30 minutes. And then the only time we give Rocephin fast is if it's IM, you know, and that's usually like 250 milligrams. So you're not giving like 2 grams. So usually 2 grams and 50 mLs, and you run it over 30 minutes. Yeah, Dilaudid. This is part three. Dilaudid. Any narcotic has to be pushed slow. All of them. I think fentanyl is the fastest, and that's at least 1 minute. Everything else is like 2 to 5 or something like that. Versed, yeah. Like I said, if it's not a paralytic and it's not atropine or adenosine, you should probably be pushing it slow. I've never had Haldol before. I've given it a lot, but I've never had it. Yeah, I know. That's the thing. And then this, and that's one of the things I tell my nursing students is I was not taught this in nursing school. And judging from the number of nurses who don't know this, they weren't taught either. So it's a failure of the system, right? We're not teaching nursing students to administer these meds slowly. Susan, yeah, morphine was on part one. This is part three. So yeah, this is I can see here the pages hanging right here. So we did narcs in the first one. Have I ever had a student insert a Foley wrong? No, because I would be standing there to make sure they don't do that. Why atominate? Oh gosh, I literally just looked this up and I've already forgotten it. Let's see, gotta look it up again. I've got it on my phone. Oh yeah, so it is to reduce the incidence and severity of atominate-induced myoclonus, involuntary muscle jerks. And if you are getting ready to sedate somebody to intubate them, you definitely don't want them doing that. Oh, Dave Matthews. I used to work in Charlottesville. So Dave Matthews, long time ago, like 1999, 2000, recorded a video for one of his music videos back when MTV was a thing, and they actually filmed it in my studio where I was working as the weekend anchor. You would be panicking if a nurse took 60 seconds to push etomidate. Why would you be panicking? Somebody asked me what I feel about peptides. I'm indifferent. I mean, lots of people use them. I don't know what the long-term effects of those are. What's the worst thing someone came in Yeah. I get that question all the time. I personally have never seen that. I know, I feel cheated. People are like, "What? What do you mean?" I have had other patients come in that other nurses are caring for. I've never had a patient come in and do that. So, maybe I'm lucky. Good morning, Zamora, welcome in. Karen, I'm a hard stick. What can I do to make it easier to find a vein? Ask them if they have ultrasound. Save yourself some pokes. If they got somebody who's ultrasound trained, just ask for it. I do ultrasound IV, so if somebody comes in and tells one of the other nurses, "I'm a hard stick." Okay, well, let me go see if Gary's available. If I'm available, I'll put an ultrasound on. We'll save some time, save some pain. Street doc. My hometown is not far from Charlottesville. Oh yeah, and then that was back in the late '90s, early 2000s, and then I went back and worked at UVA during the pandemic. Good morning, Kimberly. Welcome in. Wait, is this Farrell Kimberly from Charlie's Lives? Peps are fire. Old school Jules, thanks for the follow. Appreciate that. It is. All right, y'all be watching out now. Kimberly and get a little Farrell. Staying hydrated helps. Like, I mean, but again, if you're going to the ER and you're sick, chances are you're probably not thinking about staying hydrated. Slater, how real is the Pit show? The Pit. It's pretty. I mean, as far as medical dramas go, especially in the ER setting, it's very accurate. There's lots of things that are they take dramatic license with, and it's not 100% accurate. Yeah, Shannon, morphine's on this list. Again, this is part 2. Oh, I wrote part 2 is really small up here. This is part 3. Part 2, part 2 did kind of cardiac meds, and then part 1 did a lot of the narcotics. So basically all narcotics need to be pushed slow. 1 to 3 minutes, 1 to 5 minutes, depends on which one you're given. But yeah, none of them are given fast. Should be given fast. They can cause sternal wall, like chest wall pain, um, severe discomfort. Yeah, severe respiratory depression. As a type 1 who gets dystonia from metoclopramide, would you have any other? That'd be a good question for a physician because I can't order meds. Karen, let's see. This is Braden. Used to be a hard stick, getting to a normal weight and taking a weight lifting help. Yeah, that'll help push push those veins up to the surface. A lot of muscle mass to make them more prevalent. Male nurses are okay. Oh, male nurses are gay. That's funny. I'm not. Get out of here. I don't have Zamora's in here, but yeah, Zamora's in here. Look at that. Look, I mean, I'm not. It's not an insult to me. I don't care. I am LGBTQ plus friendly. John Bon Jovi is not as old as I thought he was. I could have sworn that man was like in his mid 70s. He is not. I don't even think he's out of his 60s yet. Crunchy Cottage. I've only known a couple of gay dude nurses. I mean, th- that you know of. That's the thing. Thank you, Heidi. Especially when you need a boost, right? Lift assist. That's who they call. That's right. Male nurses are nurses. They're just nurses. Brenny, thoughts on the SARS-CoV jabs after 5 years? Yeah, I mean, I don't know. I've not seen any long-term data on that. I mean, I've gotten lots of them, and I've not had any issues. Now, I had the original version of the virus, and that was pretty bad. Like, I mean, it almost took me out. That was well before we had any type of preventative jabs. How much is the cheating thing true? I wasn't sure about that. Somebody's asked that in another live, so I looked it up, and apparently, healthcare workers, nurses, and doctors are among the top in terms of infidelity. So I was kind of surprised by that. I thought law enforcement would be up there. They're up there, but not as much as the healthcare profession. Brenny, I have itching. Since then. Yeah, that's interesting. So there is a way to report those symptoms, and that way they can track it. Although they may have shut that site down with the current administration, they may not want to know. I don't know. Maybe they do. But I would always report because I had that happen after one. I had a mild reaction, and it's important to report all that. And that was it. Chill guy. I'm about to be a new grad, and I precepted in the ER my whole senior year. I'm hoping to get new grad E. Oh, that's good. Man, you precepted a whole year? Your whole senior year? That's cool. We only got like 8 weeks. Brenny, I'm sorry to hear that. Well, a nurse on TikTok, I'm sorry to say, is probably not going to be able to help you if all the doctors can't. Oh my gosh, yes. Daughtry? Yeah, we've seen tons of respiratory illness. Lots of flu A. Lots of RSV. A little bit of COVID, but mostly flu A and RSV. Oh, they've ended up in the same room at the same ER? Mm. Gabrielle, any tips, for a floor nurse going to ED? I switch over next month. Ooh, buckle up, buttercup. Be ready for anything. You never know what's gonna roll through that door. Could be a dry it depends on where you work. Could be a dump and run. Somebody got a GSW and friends drop them off. It could be the worst one that I can remember, makes you just turn, like, pale and cold, and, like, you like, inside you freeze for a second, is when, like, a parent rushes in with, like, a limp kid. Megan, thanks for the follow, appreciate that. I'm watching from the ER right now, ultrasound. Awesome. Like, you're an ultrasound, technologist? So you do ultrasounds in the ER? I use ultrasound for IVs. I can do a quick and dirty, like, POCUS or EFAST. I can't chart that, but I have learned how to do those. And if I saw something, I would go get the physician, and be like, "Hey, can you look right there?" But I can't go into the chart because technically we're not clear to do that. But our ER chief is working on that though, getting us ultrasound trained so that we can actually identify stuff like that. Good morning, Mandy. Welcome in. How was your weekend? Can you possibly be sedated for a fine needle thyroid biopsy? Well, I would think that for that they may be just doing a local, but that's a conversation you can have with your whoever's doing the procedure and your anesthesiologist. Brian Burb woke up at 5 a.m. after working earlies for 7 in a row. Oh yeah, I'm working every day this week. Well, at different jobs, right? So today I work my regular job. Tomorrow I have my clinical group for nursing school. Wednesday, I run rescue. That's not terrible because that's only like in the middle of the day. It's not like a full 8 hours or anything. It's just like 4 hours in the middle of the day. But it's still like it takes up 10 to 2, which is most of my because I get the kids to school, basically go run rescue, and then when I'm done with rescue, I come pick the kids up from school. So yeah, no, 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 absolutely not. It's a video game. Anyone have a recommendation for colonoscopy stealth belt? Oh, colostomy stealth belt. Yeah, I can't help you there. So maybe somebody in here can. A family member or a personal experience. So as a lifeguard, we aren't allowed certain things. What do we do for someone with no EpiPen? You call 911, manage the airway as best you can. This is Seth. I have a question. How doctors predict that cancer patients can live for months? It's based on experience and disease progression. So they'll look at what their current symptoms are, how like how advanced is the tumor with metastasis if it's spread, and they can kind of give a ballpark. It's not always accurate. Sometimes it is. Sometimes they go quicker. Sometimes they last longer. So yeah. So Michael Ketorolac or Toradol is at least 30 seconds. I've seen 15 seconds, but I would to be safe. It burns pretty bad, so I would go slow, at least 30 seconds. If they've got a bag of saline running, that's great because you can kinda, like, slow push it and it'll dilute it, but if you don't have anything running fluids, then, yeah, I would definitely go slow. Kristen Briggs, thanks for the follow, appreciate that. Any recommendations for hypertension? I'm on 3 BP meds, and they don't seem to be working. That's a conversation you need to have with your primary and maybe your cardiologist. I I've seen that happen before, and there might be some other things they need to address because if those aren't working, they got to figure out why. So maybe you need I don't know, cardiac ultrasound, see if there's any structural abnormalities or valve issues. I don't know. That is beyond my expertise. Do I know the symptoms of a shunt malfunction, like a VP shunt? I mean, I've seen that a few times. We actually have a few of those that come through. Um, It's like headaches, but yeah, I don't know. Like specifically, I'd have to review it because there's probably lots of different ones. IPMNs, how likely are they to become dangerous over lifetime? First, I would have to look up what an IPMN is. Preferred frontline med for combative patients in general area of practice. In general area of practice, I don't know what you stock. Like we can do like I mean, we do the classic B-52, but I feel like that has kind of fallen out of favor. We still give it, but I work with some older docs. Joyce, this is a 73-year-old woman in the is the Moderna shot safe? That's a conversation. Yes. Well, it's because you're at a higher risk. So, like, you're especially like pneumonia, shingles. I mean, I'm old enough now that I need to get my shingles vaccine. I've got to do that when I'm off for a weekend. I should have done that this weekend, and I don't have any plans. The first one I hear isn't too bad. I think the second shingles vaccine shot is the one that really knocks you down or can. So I think that's a conversation. If your primary care doctor is recommending that, I would go with what they recommend. Because as we get older, our defense, mechanisms are not what they used to be, and you're at a much higher risk of contracting one of these things. Has your ER ever overdosed? No, not that I've been a part of. No. If anything, we under treat. Because look, here's the thing: you can always add more. You can't take it away very easily. You can do Narcan, but I wouldn't. I mean, let's not do that. We can always add to it. I know it's not always the best approach, and at least the patients don't feel that way if they're in pain. Raven, Eric just applied to ED. Got my interview today. Congratulations and good luck to you. Bobby from Boston. Good morning. Going to be in the 70s today. Yes, it's been in the 70s and 80s here. Let's make a difference this week. It's going to be a busy week, Bobby. I work every day this week in some capacity. I work my regular job Monday, that's today, Wednesday. No, I'm off Wednesday. Monday, Thursday, Friday, Saturday, Sunday. And then I work clinicals with my students tomorrow and then rescue on Wednesday. So it's going to be a rough week. Monday cannot come soon enough. Have I worked in a skilled nursing facility? No, not as a full-time job. I've done rotations through there. I've picked up lots of patients there as an EMT. Oh, Manny's stepdad got shingles last year. Ooh, I've taken care of lots of patients with shingles. It is really painful from what they tell me. How do you fix a droopy lower eyelid? It depends on what's causing it. Uh, it you know, if it's something that you've had for a while, I mean, talk to a it could be nerve related. I don't know. I'd start with your primary care and see if they can point you in the right direction. Raven, thanks for the follow. I feel like I missed a question that you had earlier. You're talking about my geographic reason, but I couldn't find the previous one. Do you have security in your ER and do you guys have to call them often? We have I work for the VA, so we actually have the VA police force. So they're fully accredited police force and they actually have officers stationed in our ER. So yes, they're always there. Ginger Snap, thanks for the follow. Appreciate that. Good day. Good day. Good day, sir. I said good day. Do you ever push IV epi? Push dose. We do push dose epi. Good morning, El Massey. Welcome in. Holly, thanks for the follow. Appreciate that. So for those that are new, just stopping in, we've got part 3. Thanks for the daily heart me. I appreciate that. Got part 3 of the slow push IV meds. Lizanne, good morning. Welcome in. Happy Monday. Oh, so we're gonna try this again. A week from today, which will be the day off. I'm really looking forward to. I'm actually kind of excited because we've rescheduled my podcast interview with Kevin Hazard. Kevin Hazard is the author of the Freedom House book, American Sirens, and then he's got a new book out called No One's Coming. It's about the flight crews that evacuated the healthcare workers who had contracted Ebola. And so I haven't had a chance to read that one yet, but I have read American Sirens, excellent book, part of history that was almost lost. And he helped bring it back to the forefront. And I've actually seen a lot of news stories where Freedom House is being recognized. Kevin Hazard. Yeah, he is, that's his real name. As far as I know, it's his real name. He used to be I mean, he's still a reporter, but he did a story as a reporter for, 99% Invisible with Roman Mars. For those that, follow, like, listen to podcasts, you're probably familiar with Roman Mars. But anyway, he did a story on that and then ended up writing a book about it. It got, NPR picked it up. He's been on all the talk shows or whatever. I was really surprised. Like, he's big enough that I was like, I'll throw it out there and see if I get anything back. And I got a couple weeks later, he emailed me back. We had to reschedule a couple times. One, we tried to schedule it while he was launching a book, and that was like he had too much going on with the book launch. So, but he actually got back in touch with me. He's done really good about following up. So he's reached out and we've scheduled this for next Monday. So I'm really excited about it. So he was a paramedic as well. So I mean, he's worked busy inner city, high volume, high acuity um, EMS, and he wrote another book called A Thousand Naked Strangers, which that's next on my list to read. Anna's been a nurse. Cool. What's a med you push as fast as humanly possible? Adenosine. And then from what I've read, if you're pushing any type of paralytic, rocuronium, succinylcholine, then at that point they're already sedated, so you can push those fast. But adenosine you have to because it's got a very short half life. Anna's been an OR nurse for 21 years. You got a wifey or hubby? Yes, I have a wife. She is sleeping, as is everybody else in the house. I get up and do this. It's a good time for me because I can still get enough sleep. I can get up and do my live stream, do some teaching, do some learning. I usually learn something in here while everybody's asleep, so I minimize my interruption to family time. Do you think it's good to start in the ER as new grad? I think it's fine. If that's where you want to be, go for it. Oh, thanks for the roses. Appreciate that. Scroll down here. Anna, thanks for the rose. Yoshiki, I have a rash that comes back if it's too hot or I'm stressed. You need to go see your doctor. I mean, if you're stressed, sometimes physical symptoms can manifest from stress. Charlie, thanks for the rose. Appreciate that. Risk for cellulitis on a cut that was glued with Dermabond. I mean, there's always a risk. Inner thigh still hasn't closed 6 days. Yeah, it might be time to go get that reevaluated. So you want to look for anything like red or any type of exudate, like pus coming from that. But yeah, if it hasn't closed, it depends. Some of those cuts require multiple layers of stitches, right? Like you've got to go in like the sub, depending on how deep it is, sub Q, you've got to go in and kind of like pull that tissue together, and then you do the surface sutures. Letting it open like that is what they call healing by secondary intention. Is that correct? Let's see if I can remember my nursing school days. And that takes longer and it's going to leave a bigger scar. Like underneath the skin, like if you're doing those would be dissolvable sutures that will eventually just go away on their own. Charlie, thanks for the donut. Donuts. Every time I hear donut, I just think Homer Simpson. Davin, thanks for the follow. Appreciate that. Recklin is the devil. If it's pushed too fast, it definitely can be. Type 1 diabetic getting sick every time they eat. Blood sugar has been good. Every time you eat? Like, is there one particular food that always makes you sick? Because, like, the first thing I think of is you're eating any type of, like, red meat if you have alpha-gal. People are really down on Reglan, man. Like, really down on it. Oh, anybody recognize this song? Sleep Theory? They're like my new favorite band. One of my new favorite bands. Of course, Senses is definitely up there. I love Senses. But this one I like too. I actually discovered this from like some viral video that went viral on TikTok. Abercrombie fanatic. Thanks for the follow. Appreciate that. When will HIV be cured? It's coming. I mean, they've essentially done that already. where they've made it to the point with the treatments, they've made it undetectable now. That's what they call it, undetectable. But essentially, they've eradicated it from certain patients. So we're getting there. More exciting news is we're getting closer to a cure for type 1 diabetes. They're doing stem cell and CRISPR editing, stem cell transplant with CRISPR editing, as I understand it, and putting in some type of mesh that releases the beta cells, some type of implant. And in the patients they've done it so far, they've returned their A1Cs back to like nominal levels, like in the like 4.5, and no additional medications needed. So that is very promising. That is excellent, excellent news. Yeah, I've got a buddy of mine that runs rescue. He just was diagnosed with type 1 diabetes several years ago in his early 20s, and him and I were talking about the other day. He was definitely on top of it. I had heard about it, so I asked him, "Hey, have you heard about this?" He goes, "Oh, yes, I have. I've read all of on it." So, Braden, there I I feel like that's yeah, I don't know. That's a good question. I think a lot of that's preventative. Is there a way to help differentiate between panic attack symptoms and the we do it by rule out. Now we can do a quick history on somebody, and if they have a lot of stress, then we can probably lean towards panic attack. However, it's a heart attack until we prove it otherwise. So if we aren't sure, we're going to get the EKG, we're going to check your heart enzymes, their troponins, and then we're going to rule that out. If we rule out all the big bad scary things, then we can go, okay, maybe this is a panic attack, but we got to rule that out. I know, it's great news on type 1. So initially, the way I read the research study that came out, initially it had to be from a donor, right? Like you had to get something from the donor, but they have now figured out a way to do stem cell and CRISPR gene editing, something like that, using a combination of those things, and then implanting some type of mesh back into like your abdomen, and that releases the beta cells. So something like that. It's, like, super like, super high level, not something like a dumb country nurse is gonna fully understand. What's Solu-Medrol often given for when coming in with high Solu-Med so we don't give Solu-Medrol for high blood pressure and a headache. That is a corticosteroid, and we typically give that for, you know what we give it for most often is in combination with Toradol for people that come in with, like, acute on chronic back pain. And so that'll help kinda, like, tamp down their immune response, inflammatory response. Fatty liver cure, I don't know if there is one. Yeah, it's just what I call myself. Humble country nurse, dumb country nurse. I don't understand everything. If EKG is normal, why would a chest X-ray still be necessary? They can rule out, like, infiltrate, so if they have CHF exacerbation, if they got fluid in their lungs that can also cause chest pain, they can find that on the X-ray. Karen Susings, thanks for the follow, appreciate that. Good morning, Amber Diane. Headed to work. Ugh, I will be too. I'm a mid shifter, 10 to 10. Decadron, Compazine, maybe narcotic for yeah, I've got Decadron, Compazine, and Narcs on part 1 and part 2. This is part 3 of the list. If you're talking about the list, I wonder if they Lacey, I wonder if they gave you Haldol too fast. Have I ever seen any gnarly snake bites? I mean, I've seen patients come in with a snake bite. I mean, it's just 2 little puncture wounds, but I've never had a patient that required the antivenom. That's pretty rare. The ones that we have here where I live are timber rattlers and copperheads, and that's pretty much it. Don't see a lot of copperheads. Rattlesnakes are more common, especially where I live. But we have lots of like my house backs up to woods, and we have lots of black snakes, and they're great. They're pretty docile, and they will actually eat the other ones. So when I see them around, I love having them around. See, I would pick that up. A black snake, like garter snakes and stuff like that, I would pick those up. Because even if they get you, it's not gonna really hurt. Adamon, thanks for the follow, appreciate that. Little U2 in the background. It was an injection, so I'm not really sure. Oh, like an IM injection, like in your muscle? Put it in your allergies. How often do you see not very often. So there's, um so when you hear dissection, people think it's a rupture. So there's a difference between a dissection and a rupture. So a dissection, when you have an artery with a dissection, you have 3 layers of muscle. It means usually the inner one or the middle one, I can't remember which one. One of those has torn and blood is filling up that area. A dissection just means that one of those has dissected and it's filling up. Rupture is when the entire thing ruptures, and that's the bad part. Now, a dissection is also really bad. It needs to be addressed because it can lead to a rupture. Yorgi Thor, I don't ignore comments. There's 109 people in here. Everybody's asking questions. I can't possibly get to all of them. So tone it down a little bit. Like, chill out. Have some patience. John, thanks for the follow. Appreciate that. A fellow RN. Well, I'm answering questions, man. Like, chill out, dude. And when you start saying, "Why are you ignoring my comment?" Yeah, now you're on my shit list because you're being aggressive for no reason. Braden, have I ever seen a gnarly case of net? Yeah, sure have. My clinical group got to see this guy who had to have emergency guillotine amputation because it was so aggressive. It's me, Heather. Thanks for the follow. Appreciate that. Drew Steele, Don, thanks for the follows. I'm trying to find Mr. Impatient's comment, but I'm having to scroll way far back and I don't even see anything from him other than why are you ignoring my comment? So we're going to just move on because other people are asking questions. Yeah, I couldn't find it. So probably just I don't know. Curious to know how you feel about peptides these days. I think as long as you're talking with your physician, I think they're okay to add in as long as your physician's on board with it and you understand the risk involved. Where are you getting from? I mean, that's just a risk you have to be willing to take. Now, I know having gone down that rabbit hole, there are hundreds of different versions of it. And there is a whole subculture of people using those, especially like in the fitness industry. And they've been on this stuff for years. So I don't know. I think it's up to you. It's a decision that you have to make for yourself. Who wants to work my shift for me? I will go back to bed. Amber, I got to work today. I got to go in I got to go in early. Oh, so here's the worst part. As soon as I get to work today, I have to go to a class for like 3 hours. I am apparently going to be one of the nurses in the ER that checks all the other there's like 3 of us and we're the ones responsible for checking other nurses off all their skills. So we have to go get checked off on being able to check off. Yeah, that's what I said. Sitting in my car at the hospital parking lot, mentally prepping myself. You are strong, you are kind, you are smart, and you got this. No, it's not a research. I've got to go in. I guess in order for me to check people off to make sure they know how to do skills, they have to prove that I know how to do them. Mr. Gary, I ate too many broad beans and with the high fiber intake. Yeah, a lot of fiber is gonna make you have to go regularly. That's not necessarily a bad thing, but too much fiber can be a bad thing. You want the right amount, the recommended amount. I can't remember what that is. It may vary with age. I think the older you get, it require a little more fiber. Ari, welcome in. How's school going? God. Braden, have you ever Yes, I have. I answered that question. 20 grams a day. Does it change though? Like as you get older, I feel like you need a little bit more. Skills competency. Okay, well, yeah, it's 3 hours. I guess it's okay. Maybe that means I don't have to go to triage today because 'cause they'll need a triage nurse. They've already because 'cause I'm a mid shifter, so day shift will have to have 3 hours of triage before I get there and then 3 hours after I get there, so that means I won't even if I had to do triage, it would only be for, like, 6 hours. But so I imagine they'll wait and make me do triage tomorrow because I know it's my turn. It's been a while. Daniel, welcome in. How are you? In pain and discolored. Wait, what am I missing here? Osteomyelitis. Oh, there we go. Fourth toe. Hang on. Fourth toe on right foot. Partial amputation. Just split a nail. March 26th. Still March 26th. Yeah, you probably need to be reevaluated. You should have a follow up appointment coming up soon. Yeah, triage on a Monday. Mm-mm. Mm-mm. No. If you had a choice to travel from the past years, what year will you choose and why? Oh, that's a good question. Oh man, what year? I'd probably go back I'd probably go back to, like, myself in college. Oh, see, I literally just got a reminder. Don't forget your competency check off as soon as you get there today. I'm like, "Okay, thanks." So I gotta actually go to work a little early to make sure I'm there on time because it's not in the ER. I've gotta go, like, to another building on campus. Lisa, I would probably call sooner and ask them what they recommend. Tell them what's going on and say, "Do I, should I come in now to have this looked at? I am concerned." Make sure you tell them you're concerned because clearly you are. Banana, give me some advice on fluid and electrolyte exam this morning. Oh, I would say at this point, if you don't know it, you probably nothing I can say that's going to make it better. Um, I guess know your lab values. Potassium has got to go in slow. It burns. Um, oh gosh, I don't know. I don't even know what to tell you. Mary Nixon, why do people think I am a seeker? Because of the opioid epidemic. We have, we there are a lot of reasons that we had that epidemic. A lot of reasons, but we over medicated. I say we as a healthcare profession, and we caused this opioid epidemic. We got people hooked on these because the pharmaceutical companies were pushing it. They got backing from politicians. They got backing from big money. And so we pushed this because they told us it was safe and they lied and it wasn't. And now doctors are really scared to give that out because they don't want to get in trouble. And so as a result of that, I think probably systemically we are under treating pain. And the people that truly need this are not getting appropriate doses. And I apologize for all the patients that come in. I will advocate for my patients. If they tell me their pain is really bad, I will tell the doctor. At the end of the day, I can't order. I just advocate. If you were to be a doctor, what specialty would you choose? Um, Probably ER. It's what I know. If I were smart, I'd do plastic surgery, be driving a Bentley. Oh, Amber Diane has a unique perspective, has chronic pain and is a nurse, so she understands. Britta has been on antibiotics for 15 days, diagnosed with cellulitis, and one leg still red and swollen. Suggestions? Call your doctor. Yep, call your doctor. If it's cellulitis, the antibiotics either aren't working and maybe the wrong antibiotic choice. I would also be concerned about, you know, a possible DVT. And like in my ER, if somebody had pain and swelling when we treated it, thought it was cellulitis, we would still rule out DVT with an ultrasound. And that's easy to do. It's only like a 20-minute, not even 20 minutes. Literally just run an ultrasound probe up and down the veins of the leg and make sure there's nothing in there. And if it is cellulitis, if there's no clot and there is cellulitis, then it might be the wrong antibiotic, might need something stronger. Yeah, you're right. Amber's right. Yeah, we don't, I mean, we can question someone's pain, but we need to do it inside of our head. and not as part of our nursing responsibilities. Because our nursing responsibilities include documenting what they tell us their pain is. Pain is subjective. There's no way for us to objectively measure what their pain is. So the important thing for us to do is to believe them, document it, and relay that to the physician and advocate for your patient, whether you believe them or not. And we're human. So, yes, there are going to be times when someone's sitting there snacking on a Wendy's, double in the triage room telling me their pain's a 15 out of 10. And I'm looking at them going, I mean, I don't really think it's a 15 out of 10, but I can't put what I think. I can only put what you tell me. And I can't put 15. So I'm going to put 10. So, yes, there are times when we are definitely suspect of that, and there are people who do abuse the system. But again, it's subjective. How they tolerate their pain may be different. So, however, if you go to the ED, I assure you, RA is taken seriously. Rheumatoid arthritis, is that what you mean by RA? Indiana girl since 1993. I have a medical question. I don't give out medical advice. I can speak in generalities, and I'm not a doctor. I'm a registered nurse that works in an ER. Do I think that women are doubted and gaslit in medical settings? Absolutely. Yes. I think not just women, but I think especially women, but patients who have chronic pain are gaslit for sure. Hospice says that morphine helps with shortness of breath. Is that actually true? Um, I think it eases pain, which can help with breathing. Now, I know that seems counterintuitive because it is a CNS depressant, so it's actually going to slow breathing down. However, I think there is when it comes to hospice, and I think if there are any hospice nurses in here, I know Chelsea, the palliative PA, she does palliative, but she also speaks somewhat to pain management in the hospice environment as well because she works closely with those folks, and I've seen her talk about that. So yes, if it eases the pain, then it can improve their breathing. It'll also slow their breathing down a little bit. Yeah, and like I said, when you get to hospice, at that point, there are other benefits to that, and we wanna keep them comfortable. Bobby says morphine sublingual. I've never even seen that. See, I learned something new today. Sublingual does help with breathing. Hospice for decades. There you go. Bobby in Boston is done hospice for decades, and she knows. It's so funny, Bobby, because like I can't see your like I see this little tiny profile picture, and like I forget that you and I are probably similar in age, but I see Bobby the name, and I just think you're like in your 20s. So when you say things like I've been a nurse for decades. I'm like, wait, 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 wait. That's not matching up here. Good morning, Dr. Tracy Tyson, my favorite TikTok pediatrician. She's been a guest on the podcast as well. So if you have kids or are a new parent, know somebody's a new parent, follow Dr. Tracy Tyson. She does a lot of great developmental milestones videos, has a whole series on that. She's exploring autism. So, yes, lots of great information there. And if you are a nursing student or you're in med school and you want to learn more about pediatrics, she's a great reference. Holly's done nebulized morphine. I've never seen that either. That's crazy. Learning all kinds of new stuff today. Now, what do I always say? Trust but verify. So now that Bobby's told me about sublingual and now there's nebulized, I have to go look those up because I want to actually see the data. Angel, thanks for the follow. Appreciate that. Kira has 5 kiddos. Oh my gosh. 5? I have 3, but one is already like grown and gone, living her best life. I have 2 younger ones, 8 and 10. So, and they never lived here. Yeah, System of the Down. This is my curated playlist. These are like my songs. So it's like all over the place. Got like the 80s, 90s, 2000s. Kyle, I don't give out advice. We talk about medical in general. Lim, thanks for the follow. Appreciate that. Lauren, thank you. I feel that way about pediatric nurses and hospice nurses and psych nurses and geri nurture nurses. Yeah, I feel that way about them. How do I feel about med students rotating in the ER? Where I work now, we don't get med students that come through there very often. I worked at UVA where it's a teaching hospital, and I didn't mind them. I like they're kind of scared, right? They're usually in there for the first time, um, but they're very knowledgeable, especially on the book stuff. And I feel like I learned from them, and they're learning from us. Most of the experiences were really good. Manny, oh, I'm glad. That makes me feel good. Your lives really help with my health anxiety, OCD. It's oh, well, I'm glad. Like, I'm here to try and make the world a better place. That's why I chose nursing later in life. What I was doing, I was like, this does nothing for society. I'm not doing anything to make society better. So, nursing seemed like a good choice. It's, has its days, but for the most part, I love what I do. Now what I would really like to see, Zane, is getting nursing students back in the ER. Now we've got because when COVID hit, they shut all that down. They didn't have nursing students come through, and they didn't bring it back for a long time. And it wasn't until last fall that I saw nursing students on med surge. But I would love to see nursing students back in the entire hospital doing ER rotations, doing ICU rotations. So yeah, I'm really kind of fighting and advocating to get students back in. I've made it clear I will precept if they want to do their preceptorship, their practicum. If they want to do that in the ER, I will take them on. Nurses will be replaced by AI. Not anytime soon. Maybe telephone triage would be the first thing I could imagine, but bedside, no, not in my lifetime. New, yeah, Reglan, no. Does your hospital policy say that you should push it that, or is that just because that's what everybody else says? Yeah, Reglan or metoclopramide is 1 to 2 minutes, and if you push too fast, it can cause akathisia, cause panic attacks, anxiety attacks, and profound, like, drowsiness. So, yeah, don't do that. Yeah, because everyone else does it that way, and that's part of the problem. When I started, nobody told me that narcotics were supposed to be pushed slow. Nobody said that to me. We didn't learn that in nursing school. Amber Diane, my nursing class was the first one back in person in my school after. Oh, interesting. Yeah, it was a learning curve. I mean, there are nurses out there that didn't get their practicum. Jessica, thanks for the follow. Appreciate that. Scrubs, Coffee, and Chaos. ER rotation was my favorite. Yeah, I like the ER. It was kind of scary though. I went to a really busy level 1 trauma center, and it was nuts. I saw the nurse that I was assigned to make a pretty significant medication error, and it scared me to death. They had 2 medications running. Well, they had 1 medication running, and then they had blood products running. They confused the pump, and they thought they were cycling up the blood to go in faster, and they weren't. They pushed a IV med, drip through faster and left the blood product on really slow, and they didn't realize that until, like, 3.5 hours later. They're like, "Oh my gosh, why is the blood not going in?" But it was because it was so nuts. It was just a crazy in there, and that scared me. I was like, "Oh my gosh, this is an experienced nurse who made a pretty significant error. Like, what am I getting myself into?" Jessica, yes, I still work in the emergency department. I work today. I'm a 10 to 10. I'm a mid shifter. April, thanks for the follow. Appreciate it. Cameron Nerick, do you have any advice for new grads? Yes. You're in 2 months going to a protected assignment in a month. Oh, I don't know what a protected assignment is. That's interesting. You have to tell me what that is. But yes, advice for new grads: get yourself 5x7 spiral bound notebooks and write down all the things you're going to learn, and it's going to be a lot. The other thing I tell people is trust but verify. The people that you're going to be learning from are going to teach you a lot of things. Most of it will probably be accurate, but it is your job to verify those things. So if they tell you, "Hey, we push morphine over 15 seconds," I better look that up because that's not true. So just because that's the way they've always done it doesn't mean it's the right way to do it. So trust but verify is what I tell people. JB Lucky, thanks for the follow. Appreciate that. If y'all could do me a favor and tap that screen, that would be helpful. Got a great crowd in here. If you could spare a couple taps, I'd appreciate it. Kyle, the VA ER in Little Rock did amazing. That's awesome. I'm happy that you had a good experience. My nurse friend Charlie, he's down. Doesn't he have? He's down in Arkansas, or he's got a property. He's property in Arkansas, I think. I think he lives in Louisiana, but he is a cabin up in Arkansas, I think. Mr. Clean, our mid shifters, yours do 12 to 12. We have 9 to 9, 10 to 10, 11 to 11. Those are our mid shifts. Shannon, Andy, thank you very much for the follow. Sparta, Heather, thanks for sharing out the live. I appreciate that. Amber, when I was Huck, we had Hucks at UVA. I saw a nurse give oral Vanco via IO. Oh my gosh, these stories of people like crushing up meds and putting them through like IVs. What? What? Soul Glow, thank you very much for the daily heart me. Terry, I love this. I have 2 nephews in medical field, so loving. Oh, appreciate that. Thank you very much. It was liquid or still like it's a syrup. What are you doing? Like drawing it up and then pushing through an IV? Oh, did anything bad happen? Oh, I hope it didn't. That's awful. I saw a story come across my feed about a nurse who apparently assaulted another nurse with a soiled adult brief that had 1 and 2 in it and, like, rubbed it in their face. I mean, oh my gosh. Oh, comes in an oral syringe. Yeah, but those are typically not lure locks for that very reason. Our oral syringes, you cannot connect anything to them. You would have to physically squirt it into another lure lock syringe into a yeah. I the patient was fine. That's good. But yeah, our oral syringes, you can't connect anything to them. Like literally like a slip tip or something. You just gotta squirt it in their mouth or you can put it in a cup or something, like a little medicine cup. Well, that's good they were fine, but oh my gosh, that's scary. Now we're getting to the deep dive stuff. I'm like, I don't know if this needs to be on my playlist. Mandy, the ER nurses at my local hospital get assaulted. Oh yeah. Yeah, it's pretty common. Yeah, I'm sure. Well, if there's a will, there's a way. She'll figure it out. I mean, you could squirt it into I don't know. I don't know. That just boggles my mind. The amount of effort it takes to go around all the safeguards to get to that point is concerning. Oh, coffee sip. Ah. Mary Pat, good morning. Welcome in. Keep an eye on the time. We got about 10 more minutes. And then, I got to do the things, get the kids off to school. Scrubs Coffee Chaos. One thing I've learned in nursing school, if you have to MacGyver something, if you have to MacGyver something's wrong. Unless you work in the ER, sometimes there's things we have to MacGyver. But yes, you're right. Oh, just got a notification from the school. I can't imagine what that is. It's got to be a reminder for something. Mandy, have I watched The Pit? Yes. I'm 2 episodes behind. So, yes. Something just happened over on the stack. I don't know what that was. I saw balloons come across the screen. That was interesting. Why does the see? Why do the needles meant for babies still hurt? They're sharp objects. It's just and they're pain receptors. It doesn't matter how small it is. Flatline, I hate The Pit. Is it because it's too real? Reminds you of work? I get that. The reason I enjoy it is because before I became a nurse, I had a production background, video production background. And so I like watching it from a technical standpoint as well. Did I hold up a peace sign? Let me try it again. I don't know. Yep, that's right. Hey, how about that? That's pretty cool. I didn't know they could do that. So over on Substack, if I hold up a peace sign, balloons come across the screen. How about that? Thanks, Mandy. I appreciate that. Is it man? I always say Mandy. Is it? Is it Mandy? Mandis? Mandis? Tell me how to pronounce it. I don't wanna do it wrong. Yes. Ooh, Flatline. I would agree with that. They make them look heartless and incompetent, and I agree. Have I seen the SNL skit for The Pit? Yes, I have. Who was it? Harry Styles? Was he the one that did that? Was he the guest that day? Oh, yeah, here it is. Sleep Theory. This is the song that went viral. Like, a clip of this song went viral. When you hear the hook, you'll know. Sam's a first-year PA student loving the content. Hey, I appreciate that. You gotta, if you come back in, Sam, I go live 6:30 most weekday mornings. If you learn something new you wanna share, bring it in here. I always love to learn from other people. Every day I learn something new. Today I learned you could do, sublingual morphine and nebulized morphine. I didn't know that was a thing. Mandis. Ah, gotcha. No, no, no. I'm gonna call you whatever your name is. I'm gonna call it Mandis. Got it. Mandis. Because I was thinking like the IS was like plural for like Mandy. You recognize this? The clip? There's like this guy, the guy that does the dancing where he like clones himself. There's like 4 or 5 of them. Yeah. Sam, thanks for the follow. Appreciate that. Yes. So Miles, totally understand. I didn't know that Medrol was supposed to be a slow push. So yeah. But yeah, it really should be a slow push. Crystal, thanks for the follow. Appreciate that. So this is Sleep Theory. It's called Static. Here's the part that went viral. Here it comes. Also there was a version with a little girl with the glasses and the bathrobe who can dance way better than I can, and she's like really grooving, cute as a button. I'm just jealous because like, oh god, I will never be able to dance that good. I do too, Holly. Like this speaks to me. And it's not like angry, it's just you like get that aggression out, like just let it out. Are there two types of ERs? Um, no, I mean, so there are levels of acuity. So you have level one trauma centers that typically means they can take anything just about. Means they have all the specialties that if say a trauma patient came in, they've got all the specialties and the doctors needed to care for that patient in the hospital. Level 2 and level 3 trauma, they can stabilize, but most likely will not have all the specialties they need, whether it's, um, vascular surgery, neurosurgery. They might have to transfer them to another hospital for a higher level of care. You also have standalone ERs, which are not attached to a hospital. We've got some of those around here. You have what they call critical access ERs. And in some cases, there are some places where there is like maybe 1 bed, maybe 4 beds, and there might be a nurse and a respiratory therapist, and there's no doctor. It's a virtual doctor for like those places where they just don't have enough people. And that's kind of scary. I think there was a story of a patient who actually passed away because there was nobody that I guess it was an ICU where they had a virtual ICU doctor. The only doctor in the hospital was a ER doc, and it took time for them to get upstairs, and by that time it was too late, and that's really scary. Yeah. Oh, you saw that story too? Somebody was just talking to me about that, and I was just like, "Oh my gosh, that is awful." How do you have an ICU and not have a doctor in the building? Like an ICU doctor in the building? Yeah, I'm not about virtual ICU. Oh, he was a dental student? He's the one that passed? Oh, that's terrible. They should. Absolutely, they should. Yes, I heard about the one at the med spa. I've heard about that one too. Can I talk about the process of a person being sent to an inpatient mental wellness? So, I mean, that's gonna vary depending on where you work. Say, like, we have an inpatient mental health ward, so we can admit them directly to our ward. Um Other hospitals that may not have that will have to find an accepting facility. So usually the ER doc or it'll be the ER doc has to call and see if they'll present the patient, see if they'll take that patient. A lot of times it might be a transfer center that makes those calls, but usually the doctors are at some point going to have to talk to each other and ask, the receiving doctor will have to ask a lot of questions. And if they accept that patient, then we arrange transport and we can do non-emergent transport. So they have services where they can transport psychiatric patients to other hospitals as long as they are not, deemed a threat to themselves or deemed a threat to others. And I don't know. It's weird. It depends on your facility, depends on your state. Probably has different laws. Hey, Cypress, what's going on? Yeah, I think lidocaine is actually should be on this list in terms of like how like you can't slam lidocaine. There is a push rate for that. Yeah, calcium gluconate, calcium chloride also, but I mean those are typically not IV pushes. Those are going to be drips anyway, at least where I work. I mean, I guess in a code situation you can do, but in that point they're not getting any deader. So it's just, whatever. Doesn't matter how fast you push it in a code situation. All I was told in paramedic school was to push adenosine fast and push diltiazem super slow. So Miles, yeah, basically, if atropine is another one that you can push fast. If you push it too slow, it can cause reflex bradycardia. So yes, outside of that, and your paralytics, you can push those fast. But yeah, in terms of slamming it, like absolutely have to get it in fast, that's adenosine because of the short half life. Potassium chloride, yeah, oh yeah, but we don't do IV push. These are IV push meds. We don't do IV push potassium chloride. That would be a drip. And if it burns, and it will burn, it's a chemical irritant. It's gonna do damage to the lining of the vessel. So you can slow it down to like 75. You can, if the doctor's cool with it and puts an order in, you can mix it with normal saline, like run it in together concurrently. Can you learn from Grey's Anatomy? Sure, you can learn that we don't use Yonkers to intubate people. You can learn that the IVs that they use are actually the big giant spikes that we spike bags with. Yeah, I've never watched Grey's Anatomy. I've seen the clips, and it was enough for me to go, no, not for me. I don't need that kind of drama. Kathy G, Tricky Trindle, thanks for the follow. Appreciate that. Is it dangerous to take peptides at 17? Um, that's a conversation you need to have with your pediatrician and your parents. If you're taking them without anybody knowing, that can be potentially dangerous, and you should make sure you're having a conversation with your medical professionals and your guardians. Please tell the new grads about Reglan. Oh, yeah, Reglan. Push slow. And we looked it up. Oh, we looked it up just a second ago. Yep. It can, if you push it too fast, Reglan should be 1 to 2 minutes, 2 preferably undiluted, and then it can cause akathisia and acute dystonia or muscle spasms. It can also trigger panic and anxiety attacks. So yeah, don't go fast. Look, if it's not a paralytic, it's not atropine, and it's not adenosine, you should probably be pushing it slow. Oh, Paramore. Love Paramore. God, she can sing. Just about anything, really. What if it's Medro 40? So 40, I think, is like at least a minute. I feel like they say like the chart has like 40 milligrams per minute or something like that. But yeah, you should still push that slow. Gary's in here. That's weird. Let's see. Oh, did I close it down? I did close it down. That's a bummer. Oh, did my keyboard died. Oh, that's weird. Oh, it's getting close to time to get off. Oh, I hit the camera. No. What's the worst case you've ever encountered? I've seen lots of bad things. Things that would make you lose sleep because they make me lose sleep because I still think about them today. The double mics, yes, that's a good question. So the double mic, this one here, this is for Substack, which is on a different device. And this, the red one, this is my good one. This is my Rode mic. This is for TikTok because TikTok gets the best, right? Because we like TikTok. Um, and the reason, no, this isn't Evanescence. This is Paramore. Um, but Amy Lee of Evanescence has got great pipes as well. She's still making really good music. So I can't simulcast because I don't have a streaming key. I have a streaming key for Substack, but I don't have one for TikTok because they're real stingy about giving those out. The reason I use this one is because Substack is actually really good about automatically making shareable clips. TikTok will do that, but like they are only doing it for promotion reasons. They're like, who gave you a gift, who did this, and then you send it out. This actually picks the ones that are educational, like a clip where we talk about, say, a medication or a case, and it breaks it up into a clip that you can share out, and it does it automatically and even does the captions and everything. So I just download those and I can share those out later. That's why I have two. I'm working hard to only go one because I don't like using two, but I can't figure out another way to do that. I have tried streaming from TikTok's MacBook version of their studio. It is not good. It's not user friendly. It doesn't push the live out to anybody. It literally just sits there with like 5 or 6 people, and that's not what I'm here for. I'm here to meet more people, share knowledge, get knowledge, and so I continue to go live on my phone. It just whatever reason TikTok prefers that you go live on your phone. At least for me. Maybe the bigger content creators can do that, but for me, I have better success here. Charlie, my nurse friend Charlie, he feels the same way. He's tried the PC version of the studio app and it doesn't push it out. So we've both gone back to just doing it on the phone. I think he even tried an iPad at one point and that didn't work. I think that was the camera orientation because of where the camera was. It was awkward. Good morning, Ellie. Welcome in. Let's see. Oh, asking if I like them. Yes, I like Evanescence. Gotcha. Yeah. I do like Evanescence. It was interesting that song that got them popular. That was not the version they wanted. That was what the studio forced on them. She later recorded that version the way she wanted it, and it sounds really good. But I can understand her version probably would not have taken off the way the other version did. Yeah, they don't want that guy kind of like screaming. I don't even know what band he was in. I don't know if we heard of them since. Oh, Carrie wanted she wanted to be in the ER, ended up in hospice. Well, I appreciate what you do. Hospice nurses are really angels on earth. Oh, that's so funny. Do I do travel nursing? I've done travel nursing. I don't anymore. I think I'm where I'm gonna retire. Evanescence is from Little Rock, Arkansas. I did not know that. Oh, yeah. Man, it says ER should hand out punch cards. I often joke about that. Like when we get frequent flyers, I'll be like, "Man, you need a punch card. You're here often enough. You should get like your every 10th visit free." We always get a good laugh. Shoot, in this economy, I'll take anything free, right? Is it hard being an ER nurse? It can be. Yeah, it's emotionally and physically taxing. I mean, you get physically assaulted. Have I ever seen Lasix pushed fast? I have not, thankfully. That can cause autotoxicity. Oh, it gave you the worst tinnitus? Yeah, that's why we don't push it fast. Oh, we ran over time. So before we go, any celebrations coming up? Anybody taking a test? Anybody has a birthday, anniversary, anything you want to push out there? We'll wish you well. Friendly face. Oh, I like that. Friendly face. Friendly faces. One of the like if you know the if like we get a lot of veterans that come in. I mean, that come in frequently. It's a veterans hospital, so they're almost all veterans. But one of the things if you have a good relationship with them, sometimes I'll be like, man, you're here more than I am, and I get paid. But you gotta have like the right relationship, right? They gotta be cool. You gotta be cool. You can't say that to everybody because that'll come across the wrong way. But sometimes they do because they'll get travel reimbursement. So every time they come there, they can get travel reimbursement for coming there. Rapid taking finals for Masters, MSN next month. Well, good luck. Good luck with the studying. Oh my gosh. So quick story. I saw, you know how they have these like videos where they'll take drummers and they'll play them a song they've never heard before, and then they have to like make up their own drum riff for it. So they took this like classical jazz musician or something, I don't know, and they made them listen to this song by 30 Seconds from Mars. And this dude, I mean, he was older, and he would like Drumeo has one, but they have one for pianos too. And this guy was like a jazz pianist, right? And he listened to this, and he was, I don't know where he's from, but he was like, "Why is he screaming? Why is he screaming so loud?" And he goes, "No, no, stop. I have heard enough. I no don't need to hear anymore." He's like, his song does not make sense. This is terrible. So anyway, like totally tore it to shreds. And then he like ended up playing the piano. But it was pretty funny. Look, I don't mind 30 Seconds to Mars. Jared Leto is the lead singer, his brother's on drums. He is apparently not the nicest celebrity out there. He's kind of a, womanizer, probably, I don't know, maybe worse. But yeah, apparently he's not like the most likable guy out there. But his music is pretty good. Oh, all right, folks. It's that time. I got to get out of here. What a great live. Thank you all for stopping by. Take a quick look at the stats. 3,000 unique viewers, 88 new followers. Y'all did a great job. I'm out of numbers. We're going to have to come up with something new to put on the background. We'll do that tomorrow, maybe. Until then, y'all have a wonderful day. Be kind to yourself. Be kind to others. Prioritize your mental health. I'm Gary the ER Nurse, and we'll see you tomorrow morning.